A couple questions I want to answer for the news agencies that have been asking questions and blaming healthcare workers for contracting Ebola, or what it seems to be a lot of finger pointing at these healthcare workers, in my opinion. So, number one, the news agencies are asking, well, why were we able to contain Ebola patients at Emory and Nebraska, but not in Texas? Well, number one, the patients at Ebola and Emory were never on life support, to my understanding, whereas the patient at Texas Presbyterian Hospital was on life support, unable to care for himself with massive amounts of secretions. Number two, should we have transported these patients from Texas to a proper biohazard containment unit? Probably. Why didn't we do that? Okay, why wouldn't we take these patients to the safest, most appropriate facility? Okay, now that's besides the point. It's not these healthcare workers' faults that they contracted Ebola. They were in there trying to care for the patient, trying to give good care with the resources they had, and being that Ebola is highly virulent, meaning that 1 to 10 colony-forming units or viruses can cause active infection in somebody. Hey, it's almost impossible to know if you got any type of small, tiny exposure when you're dealing with that much body fluid in non-level 4 biohazard containment suits, when you're just wearing like Tyvek suits. I mean, that's not really enough protection. If the viral scientists are going to be wearing these rubber suits that get deconned with chlorine in an anteroom every time they go in and out and work with these viruses, they're giving us healthcare workers Tyvek suits to take care of a patient with massive amounts of secretions in a fairly potentially uncontrolled environment. How can you be frustrated with that? It's just, unfortunately, a consequence of trying to save somebody's life. Okay, so we need to deal with that and be positive, make better decisions, and move forward.